Adverse childhood experiences such as parental separation could lead to a heavier financial burden later in life, and it could cost the economy an estimated $1.18 billion annually. That is according to a study by the Institute of Mental Health and KK Women's and Children's Hospital. Now, this is based on the nearly 64% of Singapore adults who experienced at least one such incident. Individuals affected by such an event could face healthcare costs and productivity loss of at least $767 or more a year. Now, such excess costs include healthcare services, hospitalization, and travel time for consultations and treatments, or the lack of productivity at work. Those with more than one traumatic childhood experience incurred more than $2,160 in excess cost per year. Of the 11 types of traumatic events examined, emotional adversities have the biggest impact on economic and societal costs, and such distress include the death of a parent or witnessing domestic violence. Now, the study released in June used data from the second Singapore mental health study from 2016. Some 4,400 respondents took part in this survey. Findings show that those with one adverse childhood experience were 3 times more likely to have anxiety disorders. And some medical professionals say it could be a cultural factor.
I've heard people actually tell me that my parents would discipline me the same, but I've turned out pretty well, right? So why is this big deal that you're making out on adverse childhood events? But I think these are people that we interviewed who were 45, 50 years of age, and they still remembered that their parents had beaten them and it affected them, right? So it does show that the beating was quite severe.
There are some ways to reduce the ACE burden in Singapore. The first way is to increase public awareness of what are ACEs and its health and societal cost impacts in Singapore. This could include like public health campaigns, having educational campaigns in the schools, and also having parental support programs to educate parents of the detrimental impact of ACEs on the child's social emotional development.